BK virus is a very common virus. It infects nearly everybody as a child, and then it hides in our bodies throughout adulthood. And at times when our immune system isn't working properly, BK can come out and cause problems in the urinary tract. And this is a problem that we've particularly noticed in renal transplant recipients because the medication that they take to suppress their immune systems means that BK virus can come out of hiding and cause a lot of problems. So it can damage the kidneys, but it also damages the pipe that connects the kidney and the bladder, which we call a ureter. And really importantly, we're now starting to think that it might also be a risk factor for bladder cancer. The only response that we can take to a BK virus infection at the moment is to reduce the immunosuppression medication that a patient's taking. Now, reducing the immunosuppression is good because it helps the immune system to fight BK virus, but it carries the risk that the immune system might start to target the donated kidney as well and could damage it. So there's a really fine line that we have to tread to make sure the immunosuppression is exactly at the right place, and it's often described as walking a tightrope. What we do in the lab is take the cells that line the urinary tract and perform controlled infections with BK virus. And what we're interested in is the way in which the cells respond to the BK virus infection. Because what we've seen is that the antiviral response by the cells leads to damage in the DNA. And that pattern of DNA damage looks exactly like what we see in bladder cancers, providing very strong evidence that BK virus infections could be a precursor to the development of bladder cancer.
The funding from Kidney Research UK can help pave the way to finding new therapies and hopefully be able to help a wider population of people undergoing transplants and be able to improve their quality of life.
My Kidney Research UK Fellowship has tried to make a number of different contributions to the patient experience. It's trying to understand how BK virus might predispose us to having a risk of bladder cancer in the future. And the critical thing in understanding that risk is so that we can take the management of BK virus seriously and try to control this virus. We hope that this research will find new treatments that allow us to control this virus and reduce the risk of bladder cancer in the future.